Many Americans rely on over-the-counter medicines to help treat things like aches, pains, common colds, or allergies.
According to the FDA, there are more than 300,000 over-the-counter drug products on the market, but doctors are warning of the risks.
Cardiologist Dr. Campbell joins us now with more. So, doctor, what do you see as the main benefit of taking over-the-counter medication?
Well, certainly ease of access to these medications, where for common things like colds, you can go to the drugstore or the pharmacy and get something to relieve your symptoms that really doesn't require doctor's care. It's quick, it's convenient, and it's easy.
But there are some concerns when it comes to self-medicating. So what are some of the common problems that you've seen with patients?
One of the biggest concerns I have is when you have older patients that are already on multiple prescription drugs, there are interactions between these over-the-counter medicines and their prescription drugs that a patient may not be aware of. Some of them can be dangerous and life-threatening, so it's always important to consult your physician before taking over-the-counter drugs if you're on chronic meds.
And are there some people who are at a higher risk of adverse side effects to over-the-counter medications? Who are they?
Absolutely. People with heart disease, had prior heart attacks, are on lots of medicines for their heart. People with lung disease or asthma, folks that have diabetes or other chronic conditions can be at increased risk because they don't understand how these may affect their underlying condition.
What's the most important thing to look for in terms of information on a drug label?
The first thing you want to make sure of is that it contains exactly what it says it does. Read the labels, read the ingredients. You also want to make sure that there's no published interactions between your medicines. I think the number one thing is talk to your doctor before you get sick and say, if I get a cold, what should I take? What's safe for me to do?
You know, a lot of pharmaceutical companies make products that are meant to treat several symptoms with several ingredients, but, that can pose a risk to some consumers. So how can people make sure that they're taking the right medication for them?
You need to be aware of what's in it. A perfect example is if you take Tylenol for aches and pains and then you also use Theraflu or a combination drug, that has Tylenol in it too. And you could not know it but be taking a toxic dose of acetaminophen, which can cause liver failure and death. So you have to read the labels. If you have a question, talk to your pharmacist, talk to your physician.
All right, good information right before cold and flu season
Exactly.
hits us. Dr. Campbell, thanks a lot.